What we sought to compare in the CPX-351 versus FLAG-Ida abstract was to retrospectively compare in our patient population those two treatment modalities for higher risk acute myeloid leukemia in patients that are eligible for intensive chemotherapy. As you know, there's been no studies prospectively comparing the different intensive chemotherapy regimens in this population with MDS-related changes or otherwise adverse cytogenetics. And at this point, it's mostly left to the treating physician's discretion and/or institutional preference as to what intensive chemotherapy backbone is chosen. And so what we did was looked at CPX-351 versus FLAG-Ida with or without venetoclax, and the reason for that was that some of these data were prior to venetoclax approval in AML. And basically what we found was no significant difference. There was not a big enough population to really power for statistical comparison of different molecular subtypings in that group. However, it's interesting to note that, that it appears from our data at least that there's no significant difference. Of course, that warrants more prospective and molecular subdivided and MRD-based studies to further elucidate different variables that we might find in there. But it's at least interesting to note that one induction regimen may not be superior to another, so institutional preference and/or physician choice might be appropriate.